and thank you. This is a international forum for promoting the homeopathy. Thanks for giving me again the opportunity to speak on 1273rd lecture related to local maladies in respect of one-sided diseases. So I shall be talking about that. So before I start, good evening to all the listeners about homeopathy. I am very much thankful who have attended this webinar. As I have requested several other persons also come and connect with this lecture. So far as in my view, I think that such lecture which we usually uh, share with homeopaths, it should also be shared to the local public and in a public domain, so that they should understand that what type of treatment we are conducting and what type of treatment we are offering to the sufferer, and we can give the help to the sufferer mankind. So today's my topic is related to local maladies in reference of one-sided diseases. So there are two words, especially two words I would like to say. One is one-sided disease and second is the local maladies. So first, I would like to let the all, I know that most of the homeopaths understand these things, but however, I would like to explain that what is one-sided diseases and what are the local maladies. What we can call a local maladies. So first, the one-sided diseases are not like that as we understand, as we know, or as we hear, that it is half part of the body. No, it is absolutely wrong. One-sided disease never means that it should affect the one part of the body. In our homeopathic system of medicines, one-sided diseases are called such diseases which produced in the body but giving a very little or very few sign and symptom. And why they are giving a few signs and symptoms? Because they are intensified. And under the influence of this intensification of symptoms or intensification, other symptoms which are trivial become obscured, and they are not perceptible either to the patient or the physician. So since being a very one or two chief symptom, so it is very much difficult for homeopath to treat such diseases. As we know that we need to take whole case history of the patient so that we can create and make a totality of symptoms with several signs and symptoms. But what happens in the one-sided diseases, being the too few symptoms, other symptoms are not expressed by the patient, and we are also not in a position to gather such symptom. Patient says this is all. If one patient is having headache, he or she say, just I am having headache and nothing else. So such types of headache, as you experience in the migraine, or it may be some other cases also. So being a one or two chief symptom, it is difficult to cure, but it is not like that we cannot cure. We can cure, but in a little later on, as the medicine, whatever the medicine is given, that is the partial similar medicines, according to the sign and symptom, which is available sign and symptom. And after having the remedy response in that particular body, again, a few symptoms appear. And why they appear? Because the sign and symptom which were previously very much prominent, now it is little bit diminished their intensity. Since intensity is lost little bit, so the obscure symptom come on the surface, and now we are in a position to make the totality of symptoms, and then we can uh, treat successfully such patient, and we can cure the such patient. Now the second part is the local maladies. So for the local maladies, I would like to say that local maladies means the diseases which are appearing on surface. So there are two aspects. One types of diseases which are the internal, and another which are produced on the external part of body and which are visible by the external means, by your naked eyes. So I'd like to share my screen also.
Yes, sir.
So far as this one-sided disease, as I was explaining, that it is internal. It can be long-standing diarrhea. Internal, it can be headache. It can be cardialgia, as it has been mentioned in organ of medicine. Also, there are several other diseases also which are related to mental diseases. So there are two types of diseases in the internal complaint: mental as well as physical. In the physical, we have headache, like long-standing headache, long-standing diarrhea, or ancient cardialgia, likewise that. And another is a group of mental symptom, or we can say the several types of mania. And second part is the external, that is the local maladies. And all those diseases which we are going to focus over are basically due to chronic sora. Now, this chronic sora cannot be understood by other persons who are not homeopath, but since we are homeopath, we can understand that what is the chronic sora. And just now it was in the Hindi session, there was a discussion over the miasm also. So it is one of the miasm. There are three types of miasm which a homeopath considers, that there are three ways of infection. As in the modern system of medicine, uh, they say there are the causes, the etiology are bacteria, virus, parasites, and fungus. Similarly, in homeopathy, it is said that the most of the diseases are causes by sora, syphilis, and psychosis. So these are, and their character are defined into three categories. So basically, sora is less meaning by less means everything being deficient, appetite deficient, or any physiological function or endocrinology function. If it is deficient, it is related to sora. And if it is a proliferation or exfoliation, overgrowth, overproduction, these are termed or related to the psychosis. And there is a third category where we find several diseases are related to the degeneration, loss. So such diseases are categorized under the syphilitic affection. Okay. However, today's topic is not to discuss those things, but the thing is that is the local maladies. So let us go to the local maladies. So local maladies, as I told you, that it appears on the external part of the body. And what was happening that as Dr. Hahnemann focus over this and write down that till now the idea prevalent in the schools was that these parts were alone morbidly affected and that the rest of the body did not participate in the disease, a theoretical absurd and doctrine which has led the most disastrous medical treatment. What is happening that whenever some doctor sees or examine some local malady, let it be gland, let it be tumor, let it be cancer, whatsoever, they think that this is the only thing which he need to treat, and this is the disease part. Suppose a person is having any, let it be fibroadenoma of the breast, as the young female usually suffers. So the surgeons think that this is the part which is being diseased, and the rest of the part of the body has got no knowledge about this. So this is totally absurd. It cannot be possible that without the knowledge, without the consent, without the consent of our internal energy, that is vital force, it can appear on the body. In fact, what is happening that to prevent further damage of the valuable part of the organism or of the body, it it decides to produce some symptoms on the external part of the body. So one cannot think, one uh, cannot understand. And Dr. Hahnemann say that how they can understand that without keeping the knowledge of the internal vital force, it has appeared. and the most of the doctors treat them as a local disease with the tropical management. So this is the absurdity. So first lesson, what we want to learn, that local maladies are never a local disease. It is basically it is based on the whole organism, and it is the result of the after effect of the whole organism, and result is produced on the externals. So there now this local maladies can be categorized into two ways. First is the minor injury, that is also a cut, my cut. It can be observed in the kitchen, in somewhere. So it has got very little importance, or Dr. Heyman said, I don't want to say or focus more thing about this local injury, which is very mild and trivial type, because it gets heal up itself, and it would of not a great moment. But there are several such types of injury which are very much severe. Here, we need to learn with this phenomena, that whenever we meet with severe injury, what is happening, that our body gets sympathized and fever occurs. Remember it. So why fever has occurred? Because it is also, again, suppose that my hand is injured in some accident, severe accident. So it is not that my hand is injured, but this part of the body, whole cellular structure, whole corporeal body, that is also having the consent and conscience, and they have the knowledge that this hand is being affected, and that is why due to sympathesis they get a fever also. So having a fever, it indicates that the local maladies is not having only local, but has the affection for the entire body. Now, these diseases are the domain. There are several diseases. Suppose that, as I told you right now, that's for this severe injury. So, if severe injury, if there is fracture, if there is some large wound and some like bloodletting is going on, then we need to take management. So it is just a common sense of a physician that they will do. It is not like that they start picking up some medicine and just giving the medicine so that their reunion of bone can happen. No, it cannot be. It cannot be done like that. Like in fracture of the bone, bandaging of bleeding wounds, extraction of the foreign bodies that have penetrated into the living parts by making an opening into the cavity of the body in order to remove the irritating substance, etc. So it is to be done by treating the patient. One, or I can say that homeopath have good knowledge about that, that it has to be done. It is not like that if it is happened with the injury, if it is a fracture, if it is a bleeding wound, then they will give only medicine. No, first the management is required. But the living whole organism requires active, dynamic, and accomplish the work of the healing. Now, as we understand and we know that the healing is the natural process. Everybody knows. And every person's also know, laymen also know, that suppose a fracture has happened, so that fracture is healed up naturally. Only one thing we need to do, that the like just we has to make the alignment of two bones so that the union can happen. So if it is the bone, and if it is a two-way, and the angle and the displacement of bone has taken place, and then if we want to give the medicine and want to try to treat this is impossible. So first it should be come into the alignment, and then the medicine is required, and our medicines help in the healing process, that is the dynamic process, so that the process or the time period is hasten it hasten the procedure of the healing. So this is how homeopathy dynamically works. There are still several local maladies that which appears without any injury, but those affection, alteration, and ailments appearing on the external part that do not arise from any external injury, or we can say that have only slight external wound. Sometimes it happens that our internal body is already diseased and it is on the verge of appearing some sign and symptom, but it is not producing. But as soon as slight injury is there, slight change is there in the life, then it is ready to produce that sign and symptom. It also happens. So it is produced in a quite another manner. Their source lies in some internal malady. To consider them as again here it is said that after appearing with slight injury, if again be mistaken that if it is only a local maladies, it is local appearing, so it should not be treated with the tropical. Suppose, see, this is the keloid. It is one of the example where it appears after some scratch or after some injury, minor injury, then later on proliferation starts and a keloid forms. So this keloid indicates that it is not the disease, but the entire process of the disease lies inside. It is in the system that is to be treated. Now, if it is being treated from outside, first thing that it will never get it okay. Never, it will never be cured. But sooner or later, the disease process or disease phenomena will take place. If one person get another injury at another site, then the same phenomena will happen. So such diseases should be treated with the internal medicines. These affections were considered to be merely topical, as if the organism took little or no part, or we can say the whole living body knew nothing. This is one of the many great blunders of the old schools. See how beautifully Dr. Hahnemann has wrote that keloid or some other examples, we can say, let it be fibroadenoma, let it be several types of diseases which are appearing in the body, and they think that the internal part of the body has no knowledge about this. This is only on the external surface and it should be treated. You might have heard several times that if there is some tumor over the forehead, the surgeon or some other say, oh, it is a very little for 5 minutes work. I will just make it clear and it will be vanished. So again, this is another mistake and these blunders are being done not at one time. I won't describe much about this. So several diseases you can experience. It is happening. And why it is blunder? It is not a mistake. Why Hahnemann has put the word blunder also? Because we know that in any cases of the cancer also, let it be, I can just making to make you understand. Let us take an example of the breast cancer. That what happens, the treatment, plan of treatment of the breast cancer, that first they have planned that it should be amputated, then there should be chemotherapy, then there should be the radiation therapy. So all these therapies are being taken by the patient under the guidance of the doctor. And what happens after 2, 3, or 4 years, according to the person to person, this varies the period of time, another breast also get affected. So how that has got affected? Because every cell was knowing. So disease was not local in the breast, but it was entire system of the body. Disease was there. So next time, another breast was also imputed and all chemotherapy, radiotherapy was there. Then what happened? Again, the metastasis spread. Through the metastasis, the disease spreads in the most of the organs are being affected with this cancer. So this phenomena is happening every time. And lastly, the doctor says that they cannot do anything now. So just you need to pray. So this is not happening one time, but it is being practiced thousands of times, and same thing is being repeated. But they do not come to understand that they should treat such diseases with the internal medicine. Since they are having no internal medicine, that is why it is being done. And so far as the homeopathy is concerned, there is internal medicines only, and with the internal medicines, with the indications of the patient, with the totality of the symptom, after individualization, we can treat such diseases very easily and we can cure such types of patient, and we can save such patient from the death also. So this is the thing related to local maladies. Let us see that no external malady can arise, persist, or grow worse without some internal cause, without cooperation of the whole organism. Mind it. It could not make it appears at all without the consent of the whole of the rest of the health. It is impossible to produce any phenomena, any disease indication on the body without internal knowledge, without the knowledge of the vital force. It is impossible to conceive its production without the instrumentality of the whole life. So intimately are all parts of the organism connected to each other to form invisible whole of the sensation and function. So they are interconnected. Every cells are interconnected, and they are producing a sign and symptom, that is with the abnormal sensation and function. With this phenomena, they try to exhibit themselves that yes, I'm the disease. Just just know me and treat me. But what happened on the contrast, that if it is a local malady, if it is appearing outside of the body, it is being treated from the outside with so many procedures. No eruptions on the lip. As you know that there is a fever blister on the lip. No vitiligo. Vitiligo means there is a types of boil which is appearing just at the junction of the nail of the fingers without previous and simultaneous internal ill health. So this cannot come to the local like a disease, but it is the production due to some internal disturbance in the internal phenomena. That is why it is appearing. So it is up to the acumen of the homeopathic physicians or the physician that they should identify such types of diseases, such types of things, so that they can treat accordingly such types of diseases. Hence, all such diseases which are externally manifested from little or no external injury should be treated with internal remedies if it is wished that the treatment should be judicious, sure, efficacious, and ready. See, this is the warts. So, such types of warts are being treated with the laser treatment, and they think that with this laser treatment they can cure that patient. No, it is impossible to cure such patient, because this is the result after having the laser treatment of one or two warts have been removed. Now it is multiplying in the body. Similarly, skin tags. Skin tags are also being removed by the surgeons or by some other cosmetic surgeons, that it should be vanished, but it never happens. Sooner or later, several types of other skin tags appears in the body, because it is never local. It is appearing because there is some disturbance inside the internal phenomena of the life principle. That is why it is appearing. And this is sebaceous cyst. Just I am showing, it is like acne vulgaris. Acne vulgaris, most of the physicians say that it is due to the some bacterial infection. Yes, it is true, it can be bacterial infection, but after having so many years of treatment of taking and antibiotics, the patient never get well. I have several cases of like that, like such acne vulgaris, which are never cured by the uh, so-called modern system of medicine, but when they are treated with homeopathically, they cured successfully. And it is also said by some philosopher that acne vulgaris is the result of the internal anger which is being expressed on the external surface, likewise that. So, local maladies, when such local maladies are treated with internal homeopathic medicine based on the totality of the symptoms, can restore the entire health without any external aid or any external remedy. So see how beautifully plan of treatment is there in homeopathic system of medicine. When we treat any kind of such types of diseases which have appeared in the body without any some exciting cause, without any external injury, and if it has appeared on the external part of the body, and if we give on the basis of the totality of symptoms or individualization, the whole phenomena of the disease get cured along with the removing the sign symptoms which are manifested external part of the body, that is also removed, and the entire internal phenomena is also get cured. So when suitable homeopathic remedy is given to the patient suffering from local maladies, which is in the recent origin, which is inseparable part of the whole of the organism, it takes very little time. If it is the recent origin, it takes very little time to get it eradicated. If whether the external now somebody says that whether the external application is advisable or not. So for this also, it is advised that we should not apply anything external, because if we apply any external ointment or some external application on the local maladies which has appeared on the surface of the body. Now, what will happen? Suppose that ointment is very efficacious and it removed the local maladies indication over the surface earlier, but the disease phenomena remains. So it will be the confusion with the physician whether he has cured the disease or not. But had it given internal medicine on the basis of the totality or individualization, then if after taking in the medicine, internal medicine, and if the external local maladies is vanished, it means that the patient is cured fully, not only from the surface, but the entire body. In such diseases, the anti-psoriatic treatment should be given, and any such diseases which are not venereal should be treated with anti-psoriatic medicine. So this is as we all know that how the treatment is being planned in homeopathic system of medicine. It might seem that if the same medicine applied on the externally, there is no harm and the process of recovery may hasten, but it is inadmissible. Why I am saying this, that some physicians, homeopathic physicians, thinks that suppose a medicine XYZ is there and that is indicated on the basis of totality of symptom, then they said that what is the wrong if we apply from the external also and from internal also? No, it should not be practiced again, because if the external medicine uh, is in a position to remove the external manifestation of the disease, then we are again deceived. And if we use only that indicated medicine externally and not giving the internal medicine, again we may be deceived, because we cannot get total idea that whether I have cured the patient, because we are treating the patient, not the particular disease. So we need to treat the patient holistically, and we need to cure the patient holistically too. So mind it that these are the points which must be born into the mind before the treating of the local maladies. So, I have already explained this. So, the local maladies is removed before or the treatment of the with remedy perfectly. This is also I have already explained. Had it still been the present to guide the internal treatment, the homeopathic remedy for the whole of the disease might have been discovered. Now, what is happening that sometimes we always face such difficulties that a few cases comes after tropical application or removal of the local maladies, and if there is part remain, then it is possible that homeopath physicians with his acumen or her acumen identify that yes, this is the local malady which has appeared, and they have tried to remove it topically, but it could not remove totally. So at that moment of time, homeopathic physician with his art, he takes the whole note, whole case with a prominent note of the local appearance of the disease as well as the internal all the sign and symptoms, and accordingly treatment is planned. But now here one question I would definitely like to raise. Of course, it is coming in the next slide, that what you think. that as I told you, that local maladies which appear on the surface, and it is not merely local because it is showing some internal phenomena of disease which is developing inside the body. And as we know, I will just read out that slide also later on. And that is the it is our internal phenomena. It is official duty of vital force that it should keep our body fit and healthy, to keep all the internal organ, vital organ protected. It produces some affection, some symptoms on the external part of the body, so that we can identify with that guideline that yes, this person is suffering with the this and this types of diseases. But if it is removed from the surface, then we would not be in a position to know that what type of internal disease is progressing inside of the body. So what is happening, and what we need to understand, that if any person, now suppose that if I'm just quoting an example, that if as from the knowledge of forensic medicines and the toxicology, that if some incidents take place, like accident or some murder take place, so what is happening there in the first instance, that all those area are being barricaded with some line of ribbon, that nobody should go there, so that nothing can be disturbed, so that no evidence can be removed from there. But what is happening, why that is? And if somebody does this removal of any substance, any object, any instrument from that area, if somebody removes, he is also criminal. Because if somebody is removing, it means that he is also at the same time guilty as a murderer. So what is happening, that local maladies being one of the evidence, just showing that yes, there is something disturbance is going on inside the body. And some doctor what does, that they remove the evidence of that disease. So it is also told by the Hahnemann that this is the criminal procedure, and for this, the system or the old school should be the guilty of that, because that will produce thousands of diseases of several, for which the mankind is suffering. So let us see that how beautifully Dr. Hahnemann has written this, that it is evident that man's vital force, when encumbered with a chronic disease which it is unable to overcome by its own. What is happening? That if somebody gets some disease, and our internal vital force, which is official prime duty, is to restore all the phenomena intact, all the neuroendocrine function in the admirable condition, all the vital organ in the admirable condition, but that is not being managed, then it is what is it adopts the plan of developing the local maladies. Now, what is happening? That this internal phenomena develop a plan, so that a local maladies on some external part solely for this object, that by making and keeping in a disease state this part which is not indispensable to the human life, it may there be silence the internal disease. And by doing this, what it does, that it silence the diseases of internal, so that man can be saved, his life can be saved. Likewise, it otherwise threatened and destroyed of the vital force or vital organ, and due to deprive the patient's life, and that it may thereby, so to speak, transfer the internal disease to the vicarious local affection. Vicarious means just representation. The disease is somewhere else, but its representation is somewhere else. As it were draw, it there very little. The presence of the local affection thus silences for a time the internal disease, though without being able to either to cure or to diminish it materially. The local affection, however, is never anything else than a part of the general disease. So Just keeping in view that this is just local affection and it should be given the treatment of tropical. It is just absurdity and it should not be practiced because then a part of the general disease, but a part of it increased all in one direction by the organic vital force and transferred a less dangerous. And it is also planning of the internal vital phenomena that what it does, that the local affection, local maladies is being produced on the external part of the body, that is over the skin, and on those part which is less important organ, while keeping the more valuable organ in a protected manner. And what is happening that it is an example that old also it is not related right now. If the old school physician, it is very much important. If the old school physician should now destroy the local symptom by the topical application of the external remedies, as I told you that I will read out for you. So under the belief that thereby cures the whole disease. Nature makes up for its loss by rousing internal maladies and other symptoms that previously existed in a latent state. What happens that if we destroy from the outside, then the internal phenomena rouse, it increases to any extent, and what it does, what the disease was previously under the influence of local maladies, it was silent, it was latent, and stayed by side local affair, that is to say she increases the internal disease. When this occur, it is usually said, though incorrectly, that the local affection has been driven back into the system upon the nerves by the external remedies, and at the same time, we usually say that the disease is suppressed. And what is happening that while keeping repeated removal of the local maladies, incorrectly, though it is incorrectly, but we say that all those driven back to the nerves, and now the mankind liable to suffer several kinds of diseases after this phenomena. Every external treatment of such local symptom of the object, which is to remove them from the surface of the body, whilst the internal miasmatic disease is left uncured, as I told you. For instance, driving of the skin psoriatic eruptions by all sorts of ointment. If the skin eruptions are being removed by the ointment and burning away the chancre by the caustic, destroying the condylomata on the seat of by the knife, the ligature, or the actual cautery. This pernicious external mode of treatment, hitherto universally practiced, has been most prolific source of the innumerable named or unnamed chronic maladies, which has been written in the foreign number 80. Several number of diseases has been mentioned due to this type of wrong type of treatment. So chronic maladies under which the mankind grows, it is one of the most criminal procedure medicinal world can be guilty. Now here it is said that the medical world should be guilty of, yet it has hitherto been one of the generally adopted and taught from the professional chair at the only one. And see what I am reading for you, that has been written more than 200 years ago. And it is written here that such types of treatment, such types of removal, such types of breast cancer removal, such types of treatment of the cancer being professed and being taught from the professional chairs, although they know that they are doing nothing, they cannot cure at all. Even then, it is being taught again and again. So Dr. Henneman has said that it is the blunders. And they keep on doing because they have no idea how to cure such types of diseases with the internal medicine. For any medicines that might at the same time be given internally, severe, but to aggravate the malady, as these remedies uh, pass into the specific power of curing the whole disease, but assail the organism, weakened it, and inflicted on it, in addition, other chronic medicinal disease. And later on, what happens that again, a violent use of several types of heroic substances or heroic medicines against several types of medicinal diseases appear in the body, but it is never being cured by the old school of system of the treatment. But had such diseases, had such local maladies is being treated through the homeopathy, it can be cured not from the outside, but from the inside also, and protecting the mankind from the several further future diseases also. I'll show video later on. It's in the cauterization of them. Uh, Now, what I am planning to show you that these are the itch eruptions, just to know, and such itch eruptions are being treated with allopathic ointment or some ointment, and after doing repeatedly, it will produce several other diseases for which it can appear at any time in later part of the life. And this is the condylomatous, which is being removed by the knife, by ligature, etc., which is also a wrong plan of treatment. Had it been removed with the internal medicine, the patient would have cured. There, as I told you, there are three miasms we consider, that is sora, that is itch eruptions, and psychosis, that is like proliferation or fig wort like or condylomata. And the third is this, that is chancre, male chancre, that is the venereal disease which is happening due to syphilis. So these are the diseases which are appearing locally on the body, but such diseases are being treated with the ointment or some ligature, some cauterization, some acoustic, which is very wrong type of treatment and which should not be practiced, but it should be treated with the internal dynamic medicines. So, and these the chronic miasmatic diseases, if deprived of their local symptom, are are inevitable destined by the mighty nature sooner or later to become developed and to burst forth, and thereby propagate all the nameless misery, the incredible number of the chronic diseases which have taught the mankind for hundreds and thousands of years, none of which would so frequently have come into existence by physicians. It is driven in a rational manner to cure radically and to extinguish the organism. Is their miasm by the internal homeopathic medicines suited for the each of them without implying the topical remedy for their external symptoms. So this aphorism solely being given to just to give that these diseases, if removed, it is the it generates thousands of diseases for which the mankind is being tortured and suffered thousands of years. Had it been treated with the internal medicine, it would have not occurred. But it is happening in the same manner. So I would like to show a case. Can I show? It is one of the related to local maladies. So it is the case vitiligo, which was seen. Why I am showing because this vitiligo is also suggested, and sorry, it is being treated with the laser treatment, etc., but it is never cured. So see this gentleman, he is the by profession a lawyer, and it is vitiligo on his scalp, just on the vertex. He came to me on the 12th June for his treatment. And on the detailed case taking, these symptoms were taken. And after taking the symptoms, reportrization was done. And in the reportrization, it was found that arsenic al was the indicated medicine. And the first prescription was made on 12th June 2022, arsenicum album 0Y1 APCO company, and it was given in 4 ounces with the distilled water to be taken thrice daily. And see, within a very short span of time, because I had also not such notion that it will improve in such a fast manner, and within 15 days, that is on 28th June, the the vitiligo spots has diminished to a great extent. And later on, the 21st July, after just I will say 1.5 months, it is reduced to 15 month, 50%. And the disease, the medicine was the same, arsenicum album 0/1. Later on, this is repeated as there was some tingling in the leg due to congestion of the lumbar spine, and skin vitiligo was better. So arsenicum album 0/2 was given, and later on see how beautifully it has removed that on 2nd October, just after 3 or 4 months, it is almost 80% has been removed. And on the 22nd November, almost recovered. This is case. This case I am just showing you. And just, yes, see, this is the whole, the case is removed. And this is the photograph of the 18th February 2023. I would have explained, I would have explained in detail, but since the time is being very less, so I have just shown very fast, and I hope that I would have made justified to the topic. I don't know. So thank you very much for giving me opportunity to show you something on this. So I hope that uh, the people, the whosoever has joined might have gone some, might have received some knowledge, although I know that they are having the knowledge.
Yes,
Yes,
sir. It's really an excellent session, and you have beautifully shown what Hanuman had in his mind when he wrote about these local maladies. And you are a person who was fully fit enough to explain everything, each and every word of Dr. Hanuman in such a in a beautiful way, as you point out one by one, the
thank
quoting
you, sir.
as well as in every aphorism, and even the why this why treating these local maladies externally by using the other system of schools methods do damages to the patient. But as homeopaths, we can do a lot of good work in those conditions with our medicine. After taking the case in detail, as you just pointed out, a case of arson, nobody may think about arsenic album in those cases of that vitiligo, but you got the right remedy because you are not prejudiced. That if you the physician is prejudiced, it's a case of vitiligo, so I should go with the so and so medicine. But you instead of that, you just kept on your eyes on the disease, the case itself, and you got the arsenic album as the medicine, and then not only that, you use the latest potency, that is the LM potency for treating that case, and that you won the case in the race. And this is the beauty of homeopathy. This is what we have to tell to the public world, as you rightly pointed out in the beginning, that it's our duty to promote homeopathy among people, because they don't know what is happening with homeopathy in those conditions.
Yes,
Definitely, it really was really a very fine session. And those who want to speak to Dr. Upendra Kumar Verma, sir, may please raise your hand so that we can allow you a few more minutes.
yes,
And
yes, yes.
thank you,
If
sir.
there is any question, I can answer. If there is
Yes.
any question, any queries.
Yes, as of course we need to discuss this thing. We need one more session on this subject. Then only we will be able to go
Okay,
into the depth of the case as well as into the discussion, so that those people can have some doubts. Can you can clear it also well. It's
okay,
up to
okay.
Rampari so to say.
Thank you, everyone, and congratulations, Dr. Iko Barmaji. Very nice presentation, excellent session,
Okay, thank
dynamic
you, sir.
lecture,
Thank you,
dynamic
sir.
lecture.
Thank you.
This deals the local malady, main cause of disease, according to organon of medicine, aphorism 200, 201, 200, every very important uh, cause,
Effort. Yes.
parapsychotic syphilitic. just like mental cause, main cause of mental sign and symptom, local maladies. So very nice presentation. Thank you, sir.
Okay, sir.
Thank you.
Thank you.
Very, very
Thank you
nice.
very much.
Thank you.
Thank you very much.
Thank you.
Now I invite Dr. Sarvi to say a few words on this session.
Okay, sir.
Dr. Sarvi. Please unmute. Please unmute.
Sorry.
Okay.
Good evening, Dr. Danish and all of you. And thank you so much, Dr. Verma. It's very excellent session.
Thank you, ma'am.
Basically, organon and therapeutics. Sometimes we using therapeutics, and we must know it is the therapeutics or the constitutional or the miasmatic approach is very important, and we must learn the organon, and you explain all of them wonderfully. Thank you so much.
Okay, thank you, ma'am. Thank you, ma'am.
And now Dr. Marian Sarsheda, you can speak.
Thank you, Dr. Ganesh. Good evening, good night, good morning to all of you. Thanks, Doctor. Was an amazing session, very great concepts, just to keep it in mind. And it's very important to remark that all the local disease that we can see, except the accidents, has an internal cause that is all the movement of the miasmas. So that's very important. So please come again to discuss all those important topics.
Okay. Thank you. Thank you, ma'am. Thank you, Marine, for giving me opportunity next time also.
Congratulations.
Okay, thank you.
Thank you very much. Thanks, Dr. Ganesh.
Yes, Maria Sarsheda is from Bolivia, and Dr. Sabi is from Turkey, and now it is up to Dr. Dilip Kumar. Do you want to speak? Dr. Dilip Kumar.
Actually, I am from the outside. I am basically an engineer.
Yes,
so
sir.
just I hearing his speech because I am a patient. I is patient also. So a very good awareness program. This is for general people that we understand the whole system of disease, how our disease appear on our body and what is the internal cause. Both are correlated. So
Yes.
that is give me a very good clear picture of disease. Thank you, Mr. Verma, for
Okay.
your good lecture. Thank you.
Thank you, sir. Thank you for joining and listening to us. Thank you very much.
Thank you.
Because you are engineer and you are my patient,
Yeah,
although I have requested you to just join and just see that what we discuss usually.
yeah, right.
Thank you for giving you sparing your time.
Yes, definitely. We have people other than homeopathy can also join the session. This is the beauty of this international forum for promoting homeopathy. We have homeopathic lovers, students, as well as homeopathy doctors here in the forum. Thank you, Dr.
Thank
Dilip
you,
Kumar.
sir. Thank you.
Now it is up to Dr. Neha Kakar to say what are thanks, as well as can ask some questions also.
Yeah, it was a very wonderful session from Dr. U.K. Verma. He revised us the various aphorisms laid down by Dr. Hahnemann, and we need these constant revisions again and again because it keeps our morale boosting, and it keeps instilling us the philosophy which Dr. Hahnemann has laid into us, so that we can inculcate these values in our daily practice and treat the patients homeopathically by philosophy. It was an excellent session, sir, and we hope to have many more sessions from you.
Okay,
And
thank
we
you.
can, sir, you can take the aphorisms also, one by one. That will also be a very enlightening session. If you can
No. If you allow me, I can teach also. But
yes, sir. This is an open forum, and everybody can, share their knowledge. Like we can also have, sessions aphorism wise, where we can
very
discuss
good.
each aphorism one by one, and everybody can put their own inputs. All the
Okay.
doctors. Yeah, we can arrange that. Anybody can do that, and everybody can put their inputs. I hope Dr. Dhanesh would agree with that. Our seniors will agree with that. So
Okay,
it was a
okay.
wonderful session, sir. Thank you so much.
Okay.
Nice
Thank
to
you.
meet
Thank you.
you
Thank you.
again.
Tomorrow we will have a session from Dr. Javed Akhtar, doctors from Pakistan always follows our Saigal's method. So you can watch a beautiful session from you, Dr. Javed Akhtar tomorrow.
Okay.
With that, we come to the Varma sir, do you want to say anything?
No, I don't want to say anything, but I would like definitely to thanks all those who listened carefully. And what I wanted to convey on this forum, that even we practitioners, we forget during practice that what is to be done in such cases, but we just give the therapeutically indicated medicines, and we do not treat, and we forget to treat the patient as a holistic, which is the sole guideline for given by our masters. So keeping in mind, don't pick and choose the medicine, but give the medicine which is indicated for the patient, and that give the wonderful result. Just having in the heart that yes, you will treat disease on the basis of the principle, then definitely cure will ensue.
Thank you, sir. With that, we come to the end of the day 1273.